So without further ado, we'll start with Ontario/Quebec/Atlantic.
All right, that's me reporting. I think the slide will come up pretty soon. Okay, great. So quickly, we talked about local action as a citizen, and we talked about the importance of engaging. So with politicians, community groups, business and media, we talked about being and making sure we're informed and using credible information and kind of taking a responsibility. We talked about as professionals how we need to lead by example and advocate for climate change. We are talking about how we need to play that role in these movements and take that health equity lens. We talked about kind of framing it in environmental justice and kind of connecting those dots. And as an organization, we talked really about how we need like dedicated positions and space for doing the social justice work and it also of course connects to the environmental justice work. And reallocating resources would be required for that. We wanted to talk about COVID and using that and thinking about it through an environmental lens and like what changes we want to see in our organizations as well. Like the online conferences were as an example, how it didn't seem possible before this and now it is, and seeing it through how that can make a great change environmentally, and also about the need for training and education in social justice work and setting new values and reinforcing norms and values in our organizations as well, and finding that professional development in these new kind of spaces in environmental health and justice. And that's it as quick as I could.
That I was on mute, whoops. Yeah, no, that was quick, that was awesome, that was great. Looks like you guys had a lot to talk about and you guys had a pretty good sized group, which is awesome. So we'll move on next to Manitoba now, who also had a nice sized group. Thanks again.
So our group had a lot of the same types of conversations about working more across systems, focusing on systemic interventions instead of individual behavior change, and keeping that equity lens throughout all the work that we do, all the policies we develop, using an intersectoral approach, engaging a variety of voices and groups, making sure the right voices are, not the right voices, but all voices are at the table from the beginning, which would be all the stakeholders or a representative of all the stakeholders that may be impacted by systems. We talked about exploring the ways that MPHA can engage more broadly and potentially have more working groups related to this topic, because MPHA is a fairly new organization, so there's lots of great opportunity there to build capacity in this area. We talked about different projects we could get involved with. How can we talk more about sustainable food systems in the terms of a Manitoba context, and in terms of northern food insecurity, and taking a look at who is at the table. Again, that was a really common theme. And there's some really interesting sharing about climate change and health vulnerability and adaptation assessment, some work that has been done with within WRHA from one of the group members that we're really excited to see that work when it comes forward and take a look at how that could affect the planning for MPHA as it moves forward.
Awesome, great. Thanks very much, Manitoba. That was great. And then we're going to move on to Saskatchewan now. And looks like Fleur is already getting it ready to go for me. Or is going to be the one to speak?
Oh, I'm going to speak. I think Jordan is screen
Jordan is the one that has it. Perfect.
All right. But I'll just get started in length of time. So we have both municipal and provincial elections coming up this fall. And we had a bunch of advocacy planned around the provincial election that kind of got slowed down by COVID. But I think we sort of realized in just the discussions over the last 2 days that there's so much that we could do at the municipal level that actually in some ways might be more effective with the government that we have provincially in Saskatchewan, and we might have again. So I think what we ended up coming up with is probably from a Saskatchewan Public Health Association point of view, I think we're going to set up a couple of working groups, one around food security and food sovereignty. We talked about working with maybe working with farmers. There's a Saskatchewan Pulse Growers Association, so that's lentils, peas, other things like that, that maybe we should do some partnership with them. We also talked about a guaranteed income working group. There's definitely been much more discussion about that, and there's more public appetite for it, I think, and at least people have actually heard about it now because it's really been in the media quite a bit. We also talked about some anti-racist education we could have talked for another hour. It was like we almost kind of got ramped up, and then we were like, oh, 10 seconds. So that was actually a lot of stuff around the organization. There was some discussion around what we can do as professionals. Some things we talked about were around sharing resources that we know about, and I think really just getting our organization more energized. I mean, we've been on a journey in terms of reestablishing it. We're about 5-6 years into that. I'm sure we could probably connect more with the associations like Manitoba around that as well. I think that some of the smaller provinces that have smaller associations, and maybe I'll just leave it at that.
Well, awesome. Well, thanks very much for that. We're going to move on to Interior and Alberta. And we know we tried to give you guys another 15 minutes to have a little bit longer to talk, but we knew that was probably going to be the case. So our facilitators will hopefully in the next couple months, I'll be sending them some instructions on how to follow up with you guys to see what happens with this local change plan you guys are making. And of course, we've got the networking contact list too that you guys can use. So, we're really hoping to just have all these lessons go beyond these 2 days and go into the future and really help you guys get the tools to make change in your local community. So yeah, on to Interior BC/Alberta Group.
Great. Thanks, Christina. So I know Chow's going to pop our notes up there in a second. So I facilitated this group. It was a really nice group of 15 diverse people, perspectives, organizations. It was a little bit hard to be thinking local. Maybe we had the same problem as Atlantic, Quebec and Ontario, in that about half of us are in Alberta and half of us were in British Columbia. And in the interior, we had BC. We had diversity also between our Okanagan region, and then also someone from the Lillooet region. So we had some really rural as well. So wide-ranging conversation. We didn't stick to talking from a citizen, a professional, organization. We just kind of opened it up for a wide-ranging discussion. Thanks to Chow for kind of popping things in different places. So I'm just going to go through it in the columns briefly. So from a citizen perspective, there was discussion around when we engage locally, are we taking our professional and then thinking about how we can engage as a citizen, or are we engaging as a citizen to try to influence in our professional or world? So this idea of being a citizen was kind of interesting. And one example was this West Kelowna example, where West Kelowna has really identified citizen engagement and having an engagement platform as an important part of what they believe is important as a municipality. And that just creates this natural environment where we can engage as a citizen if we live there, but then we can also put on our professional hat as part of what we do. So taking advantage of those kinds of things, but really recognizing that the approach of your community, if it's an engaged community, then you can really benefit from that. From the professional perspective, we talked about potentially bringing kind of activism into our setting. So one of our group members works in kind of tertiary care hospital setting, and then thinking about, well, how can we engage environmental issues in a setting that typically is not where we talk about environmental issues? Like, how do we make sure that our work in a hospital, we're recycling paper as a very fundamental thing that's kind of important? How do we get a group paying attention to that, creating a green group, for example? So we talked about that as something that's important to do, to bridge those things, and that bridging piece being either a natural part of what we do because we're just naturally engaging across the different worlds, and if we're natural engagers, we probably don't think about it, but being intentional around how we create the bridging and doing knowledge translation and those kinds of things. And then part of being good at that and part of thinking about what we do as professionals, we had a bit of a conversation around this reframing. So the idea of language and the way we talk about things and the way that we bring things together is really important. So we need to think about supports for our professional context so that we can do that reframing. And then when something is in transition, really taking advantage of that. So this pandemic is giving us an opportunity because it's creating this transition. And then we had a discussion around organization as well. It kept coming in and out because, of course, the context of a single health authority, Alberta Health Services, and then, of course, we had a number of people from Public Health Agency. So when you think about those kinds of big bureaucracies, there's both opportunities, but there's also barriers. And how do we think about that? And technology came up a couple times in that people are using, whether it's Teams or using Zoom to bring together people who don't normally come together. So there's an opportunity that we can try to influence our organizations to think about ways of bringing the less traditional people together, because there's fewer barriers to doing that kind of thing. And really making sure that we've got diversity. And I know we've heard it a couple times from the other groups that having the right voices, which means a diversity of voices, is really important. And so we need to pay attention to that. So I think that's it in a nutshell.
Awesome, thank you very much. I'm sorry I keep on going off of video. I'm trying to eat lunch at the same time and I don't want to look like a pig. So let's move north to northern BC / Yukon. What have you guys talked about?
Okay, I am going to present Christina, so let me just pull up my slide. So we had a small but mighty group that had a lot of conversation, very, very similar to a lot of people with some unique northern differences. But in terms of local action as a citizen, we said coalition building, which we also put under organization as well. And this really came from the idea that came out today of this, health and all policies approach and the role that public health can play in influencing the complex issues of the Anthropocene and some of the paths forward. Even just taking our own time to volunteer with organizations that are already doing local change work can make a huge difference. Educating ourselves as well as, youth, the next generation, and our own social networks and families on these issues. We had some discussion around, some people felt overwhelmed with all of the information that we've taken in the last 2 days, and it's almost like too much to learn in a short period of time, and so taking these things in more digestible chunks and helping get everyone on board with that learning. And then individual actions around food waste, reduce our own food that's wasted, as well as reducing our use of disposable plastics and containers. So simple actions that individuals can take on their own. As professionals, we talked about trying to always apply an equity and ecological lens in any analysis and knowledge mobilization that we're undertaking in our work. So how we're presenting evidence to influence decisions. Collaborate alongside local, I just sort of use the blanket term, environmental stakeholders and organizations. And we had some frontline workers in our group, which was really great because they got to talk about, how they can, so the example was recognizing the impact of natural spaces on mental health and how does that get incorporated into mental health work. And that usually will involve local environmental organizations, so partnering with them. continuing to bring attention and awareness at every table we sit at as professionals, and then capitalizing on opportunities that arise in conversations to highlight issues like climate change. So someone mentioned, you know, the offices got shut down and they couldn't provide any services for a few days because of local flooding. Well, how do you take a learning like that and apply it to sort of this bigger picture? Bringing these ideas back to our teams. And then we also talked about innovative ways to build up the workforce. So this was something I think perhaps not unique, but we experience it a lot in the North. Not necessarily issues with recruitment, but issues with retention of public health professionals. And the example we were honing in on was environmental health officers. And so it's great to talk about how we should expand the role of environmental health officers and have them as boots on the ground for a lot of this work. But if we can't find environmental health officers to work, you know, that we need to get more innovative and creative. And you know, I talked a little bit about the unique opportunity in the Yukon we have now that our college has become a university, and can we model some of the things that have been done by South Central Foundation in Alaska, where they created their own curriculum to meet their workforce needs. And, you know, is there an opportunity to partner with UNBC on similar initiatives? And then finally, local action as an organization. So this was an interesting one because Yukon technically doesn't have an organization. So someone brought up, Christina, what you had mentioned before, creating a Yukon chapter of the Public Health Association of BC, which I think is a great idea. And joining with Northwest Territories and Nunavut as well in their organization, or how do we bring them all to the table? There was some discussion of preparedness. So how are we doing our co-emergency planning, for example, pandemic planning, wildfires, having multiple disciplines at the table, but also not forgetting to discuss prevention as well as preparedness, because so much of the conversation often goes to preparedness rather than prevention. And then another sort of unique northern aspect I think that got brought up is recognizing that our economies rely heavily on resource extractive industries, and it's a real challenge to get away from that here. Mining, forestry, oil and gas. So how do we create a collective place where we can share ideas that are working for new approaches to economic development in the North? Whoops, and one of my points, I forgot to enter it there, but basically just, you know, encouraging PHABC to continue working groups in this area and opportunities for conversation. So maybe a Northern working group. Does anyone else want to, from my group, want to share anything?
Sounds like you did an excellent job of summarizing it, which we always knew you would be able to do. Thanks for all of your great help through the last couple days. So now we're going to go over to the Central and North Vancouver Island / Coastal Group, another one that kind of got put in together because as much as I tried to separate you guys all by region, I didn't want to have only a couple people in each room. So for next year, tell your friends, more people we have, more groups that we can have, and the more local we can talk about stuff. So yeah, you know, just a little advertisement and push for next year.
Okay, so I had the pleasure of joining this group. I'm actually in Northern BC, but I got to take notes for this group and had the opportunity to collect some ideas sort of from an outside perspective, which and then was elected to present. So we had a lot of really similar themes kind of across all three of these subjects as a citizen, as a professional, and as an organization. So A lot of it was rooted in food and different ways that the Anthropocene kind of challenges connect to the food system and food waste and all of those kinds of things. Engaging around conversations and kind of taking some time to reflect on our own organizations and our own actions was a big theme that also came up. And then connecting with the environment and starting some of those conversations. So I'll just really quickly go through our kind of top points from each section. So local action as a citizen, as I mentioned, food choices and actions. So things that came up were like eating less meat, being more conscious around where the food is coming from, supporting local businesses, engaging and sharing with others. So again, kind of taking some of what we're learning today and being able to share that out with others. Conversations with others with different points of view. So trying to expand our points of view a little bit more and learn from others. Reconnecting with the environment, and then becoming more engaged politically. Local action as a professional, we talked a lot about learning more about what our organization is doing as it relates to the Anthropocene. So kind of taking this lens that we're learning about today and yesterday and trying to fit kind of that bigger picture into understanding our own organization and where there might be some gaps and how we can kind of fill those in. Again, engaging with more conversations with colleagues about our own organizations and within our own organizations in terms of what we're doing for broader community, engaging with local government and planning programs that support well-being. So another big key topic that came up for this group was around addictions and those kinds of supports. So what we're doing in terms of supporting vulnerable populations. Local actions as an organization, again, looking at the own organization, taking that time to reflect and looking for ways that the Anthropocene challenges are being addressed, and again, for some gaps and how those could maybe be better addressed. Working on improving systems around food security, food systems, and food waste. Partnership was another big theme that came up, and connecting smaller organizations to larger organizations and health authorities to municipal government, and trying to create a bit more of that sort of cross-sectional connection. Improving programs and supports around well-being. Focusing more on upstream prevention, so kind of trying to shift away from Band-Aid solutions and really kind of making an effort to put more resources towards these upstream prevention ideas, and then using educational opportunities to network and engage with others. So that's sort of a really brief high-level summary. I'm not sure if someone from the group wants to jump in with any regional specific examples, but those are some of the key highlights from the conversation we had.
Hearing nobody, I'm going to move on to the Victoria and Region guys. Thanks very much again, Margot. That was great. And so we've got Maureen and Chris in the Victoria Region, and then we're going to finish up with the 2 Vancouver groups. We are almost about to go into our break. I will note that we are going straight from this session into the closing. So we're going to be skipping that break to get you guys onto your Fridays a little bit quicker. So just be aware of that. This will probably go over a few minutes, but then we'll head straight into the closing. So
Jade is going to be speaking for the Victoria area. Thank you, Jade.
Thank you, Maureen. Thanks, Christina. And thanks, Chris, for taking notes. So yes, I hope I'm going to do this justice. But in the region, we felt that it was a really kind of dominant theme across all of the action pieces as a citizen and professional organization to go past your silos. Partnering with organizations that are doing similar work, and even within, I think, our own institutions, breaking down those departmental silos. So as a citizen, we talked about getting involved with community associations and organizations. We talked about some of the individual actions that you can take, so the top 10 steps you can take, and maybe having like a mechanism to kind of help to support those top 10 steps, maybe like a fact sheet or educational material or whatever it may be. Definitely there was quite a bit of discussion about talking to your counselor, some elected officials, and having those kind of conversations, advocating for the inclusion or consideration of health and all of that, what we've just talked about in these last 2 days. You know, again, having those kitchen table conversations, so speaking with your neighbors, family, and friends, and talking too about, so Trevor in his One Planet region that kind of set the stage for our dialogue today is, you know, maybe there's going to be some documentation coming out of the One Planet Saanich, and that we could take to our networks within our neighborhoods, and to other municipalities within the region that don't have a similar structure as, or a program as Saanich does. Moving on to local action as a professional, we talked about engaging with your professional associations. Interestingly, I know it's come through the chat, as an environmental health officer, you know, I was reflecting on kind of taking it back to my own association and organization. We were talking about writing articles in professional publications, so helping to get that word out, incorporating ecological determinants of health into health curriculum, whether it's at the universities, colleges, other institutions that are training professionals, and having that really as a key embedded principle into that training. Sharing and distributing tools and frameworks to support advocacy and education within our kind of professional roles. And then moving on to local action as an organization. So, you know, that opportunity, again, kind of the theme of going past your silos and the opportunity to cross-fertilize with other organizations and across sectors. It was definitely brought up around continuing the conversation on place speak, and I must confess it was new for me, but learning about PHABC having a mechanism and modality for engagement through that forum. Professional advisory councils, so, or committees, and having those dialogue with those councils and committees with respect to these issues, and sharing and distributing tools and frameworks to support advocacy and education. I hope I did that justice, group, and let me know if there was anything that was missed.
Good job.
Thanks.
That's great. All right, so we've got 2 more groups left. They're both based out of Vancouver. So we're going to go with the first Vancouver group, who was led by Dr. Malcolm Steinberg and Dr. Irv Rootman and Chrissy Best. And take it away. And then once you guys are done, we'll go straight into Betsy McKenzie's group.
Hey everybody, so our group to discuss a lot more than fits onto the slide and 3 to 5 points, but basically I think the easiest place to land for everybody was in the local action as a citizen and imagining what they could change themselves. And first point, or one of the first points, was educating yourself about social issues and committing to having uncomfortable conversations with family and community. Recognize your role as a social change agent with your immediate social networks, and be an ally. And there was a lot more to the be an ally piece, and a lot of advice and good resources to how to be an ally that are more captured in the notes, but it was definitely a theme for that conversation. Volunteer with Camp KT, which is down in Vancouver, was one of the options of how people could take immediate action to be engaged. And another point in terms of local action was making relatives and friends aware of the Anthropocene and the initiatives to combat fallout from it. There was a commitment to broaden the definition of health, including environmental health, etc. That was really a revelation with some of the attendees as part of this event. And tap into the One Planet conversation, which was something people were interested in as part of a local action as a citizen, but also as a local action as a professional. And there was kind of a query whether there would be potential opportunities pointed out by the Summer Institute organizers in terms of how to get engaged with those types of conversations and follow up to the event. In terms of other action as a professional, there was intent to make colleagues aware of the Anthropocene, and the same kind of have conversations, bring awareness to the forefront and how things could be addressed, and also try and bring more awareness to the impacts of the TMX pipeline and a commitment to working with SFPU to bring about change. And then I think local action as an organization was the most difficult for the group. We had the fewest points here, but nevertheless, there was commitment from the BC chapter of Health Promotion Canada Network to continue doing the kind of work that the summer school or institute has brought to the fore, and or put his contact information there if people want to learn more and get engaged. And then there was a desire to have PHABC basically help move forward with partner organizations that are invested in this work, and help basically bring together the information from the Institute and make it available and share it again. And I think I'll leave it at that.
It's great. Thanks very much. Yeah, well, we're definitely got a lot of stuff that we'll be sending you guys after the Summer Institute for sure. We've got a lot of resources that you guys have shown us in the chat that we're going to be getting, and just a whole bunch of stuff. So we really hope that you guys will be able to get a lot of use out of what you'll be getting from this Summer Institute now and in the future. So we'll go with the final Vancouver group now.
Yes, thank you so much. Well, it's lovely to be the last group because so much brilliance has come beforehand. Some of it we touched on. So I'm going to just draw some high-level thoughts together. I wanted to thank Craig for the incredible scribing and consolidating work, and to Betsy, who kept on making sure that we thought about what was the local action involved in all of our big thoughts. We also started our conversation in a place that a lot of people sound like they did as well, and folks by Tim, was really about moving to action and orienting to justice and not to order, and remembering that these were insights from Martin Luther King. And so that theme of boldness and courageousness was there. We had some questions about how to capitalize on this moment, this public health moment, generally from, and also the foregrounding of public health. And so wondered if one of the things we needed to do was find out what is actually our scope of activism within the PHABC, and how we can really intentionally create strategies for working towards concrete change together, and to making these alliances very intentionally. And so that would be something that could be scoped and modeled and maybe even legally clarified at the provincial level through the PHABC, and then trickle down and inform our local engagement strategies. We also thought again about how we can think differently about health, defining health for all beings, so humans, animals, and nature, as we've talked about in the Institute, and placing in that notion of health into the notion of health in all policies. And we thought it would be great to have a conversation with Bonnie Henry and Danielle Ben-Smith, who's the Aboriginal Health Advisor to her, and to really try and get traction on this COVID moment and making these kinds of links, and being quite courageous about that organizationally, and then reinforcing that locally. We also overarchingly wanted to suggest harvesting ideas and tools and resources and experts and advisors and companions from the people who presented in the summer school, and use that as a way to generally create notions of collaboration and sharing and touch points, and to then trickle that down and adopt them as local actions. So those are the general things. We also wanted to try and start some case study learning from different issues in our local area that bring together these issues. So certainly the Kinder Morgan pipeline was one of them. Another one that was mentioned was migrant workers or vaccine programs working with Indigenous partners. So really trying to figure out what are the big structural issues and equities that we're trying to work on. How are we learning about how we're working on these issues more effectively? And how can we actually take actions so that we truly have diversity of voices, experience, stories, people, including youth, so that we can do work differently. So really learning by doing and learning through doing and being really intentional about that. And we wanted to suggest that we, as the two Vancouver groups, get together and create some regular touch points so that we are collaborating and that our local groups are doing what they're doing locally, but also mapping back to that provincial scale, because the goal is to do better things and do them better, always increasingly, but also to be more than the sum of our parts and being very strategic from a governance perspective to an organizing perspective and so on, about this being the time for public health to move into this new or recalled era of activism. So anything else from our group here? I know I didn't touch so much about the columns, but that was sort of the sense or the feel for our conversation.
It's Betsy here. Just the civil disobedience was in the context of the pipeline, and we spent quite a bit of energy on that as a group. So
yes, we were the radical group. I would say.
About that. There is a conflict, of course, because part of the civil disobedience is breaking the law. But it's interesting, this past year that the Lancet editor came out, this is Richard Horton, saying that it was justified in the case of the climate emergency to break the law because as public health, we are responsible for protecting our citizens from health threats, and that this is an existential health threat where civil disobedience was warranted.
Mm-hmm.
I have a Lancet article on this.
Yeah. Tim, you're always so great with the evidence, and I just love that about you. It's really helpful in a curriculum. I do want to say that I think that there is an appropriate place in terms of advocacy and action for civil disobedience. I would caution that for every person that goes over, what we say going over the fence, there should be 10 people in back to support them, that there are legal ramifications for the individual and their families, and there has to be a very considered approach. And so on a personal level, it's something that as a peace activist I was involved in back we talked about Physicians for Social Responsibility earlier on in the anti-nuclear movement. I was coordinated the West Coast activities in response to that. So I will say that it's not everyone's option or choice, but it is, especially when you think about the water protectors in the States, and think about the role of Indigenous persons and the extraordinary burden that they've been carrying. We have an obligation to be allies. So this is not speaking on behalf of PHABC, but as a citizen activist. So we're grateful to have that understood as part of the lexicon of action that individuals may choose to take. Thanks.
Awesome. Yeah, great points, Shannon. And thank you everybody for all of your excellent overviews of everything you guys talked about. Looks like there was, once again, some excellent discussions that happened. So in the schedule, there is the break. As I said before, we're not going to be doing the break. We're going straight into our closing. I'm just going to see really quick if Trevor or Maya have anything to say, and if not, I will hand it over to Samantha Salter and Theresa Healy. You're nothing? All right, Sam and Theresa.
Sorry, I was muted.
Yes,
okay. I did just want to thank all the folks who have been part of this event for the last couple of days. I think the presenters have been really quite wonderful. The participants have engaged in wonderful ways. We've had great note-taking and reporting back. The PHABC team, I salute you. Done a great job, and it's really been very exciting. I think we've started to tip over in a positive direction. So I think good to everybody. Thank you.
I suppose I'll just echo that, and Irv, I see your hand too, but thank you so much, everyone. It's been a very inspiring and I think sea-changing moment here, at least for me. So take care.
Irv, did you want to say something?
No, but
You're
we should
muted.
thank Irv for helping to get all of this going in the first place many years ago. And
Irv, you're muted. Okay, I guess we'll leave it and carry on.
I'm unmuted. I just said that I was just mocking Trevor for his hand fist up. But anyways, I really enjoyed being part of this, and I think I done a great job in putting it all together. And I never dreamed when I came up with the mini idea of having a summer school that it would end up being something as fantastic as this.
Wow, it's nice to hear from the master. Thank you. So we will be sending out evaluations, and we will hear from everyone about your thoughts, and we will definitely be back in touch about leadership in the conference. Margot Parks and Trevor Hancock will be our co-chairs for the conference. So we have a lot of continuity in our planning, and I have some thank you comments I'd like to make at the end, but I think now would be great to hear from Samantha and Theresa. Thanks.
Thank you, Shannon and Christina and everyone. I'm going to let Theresa take the floor first. She has, as Shannon mentioned at the beginning of the day yesterday, she's been creating a graphic recording of all of our conversations and presentations throughout the last 2 days. So I'm really excited to see her brilliance and what she's come up with. I know last year it was a real treat. We didn't even ask her to do it. She just did it on her own accord. So Theresa, I'll hand it off to you. I think you're on mute, Theresa.
We still can't hear you.
Theresa, darling, we can't hear you. So we can't hear you and we can't see you.
Uh-oh. Okay, well, we lost her visual. Okay, maybe I'll jump in and go first.
Sure, and then we'll bring Theresa back in.
And then we'll bring, it'll be a nice way to cap it all off. Oh, you're back, Theresa. We still can't hear you.
You might be muted on your headphones as well as your computer. So you might have to unmute both your computer and your headphones.
Why don't you go ahead, Samantha?
Okay, sounds great. So I tried to capture a bit of the conversation from today, and so I'll just share my screen here. And then I have a very important evaluation link that I promised Christina I would share as well. So I thought, it was a really kind of brilliant way that we moved from these global concepts and understandings yesterday about what is the Anthropocene, why does it matter, how are all of these concepts interconnected, to really understanding how does this translate to local action on the ground. And Stephen did such a brilliant job summarizing yesterday and closing the day, and he finished with, I hope you don't all go home and have mental health issues. And I think that's a reflection of sort of the magnitude and the gravity of some of these issues. But then Stephanie opened with such brilliant words and a brilliant song this morning that I think really set the tone for positive action and movement on a lot of these issues, and what we can do in the public health community. And so we had the opportunity to learn about the application of One Planet, and some of the key principles of health and happiness and equity. And equity was really a theme that arose in a lot of our discussions today. When we're looking at the intersections of human, animal, and environmental health, and how public health can influence all of these upstream, through housing, through energy, through transportation, through food systems, through economic systems, really it all came back to when we create these systems that are good for health, they're equitable, they're just, and they're sustainable in the long term. Another thing we heard a lot of today was who is at the table. And I think this comes out as part of the how. So how do we, really move towards that sustainable and just future? And it is giving meaningful voice. And when I say meaningful, I mean not tokenistic. It means there's shared decision making and there's shared accountability. So really, encouraging everyone, when we go back to our work, think about who's not there. And even if we can't think of a reason for them to be there off the bat, recognize that we all have biases, and there are likely very good reasons to have a diverse range of voices at the table. And when we receive feedback, be open to that feedback and be open to listening and learning and changing. And so I thought Stephanie's 7 teachings that she spoke about at the beginning, love, respect, humility, truth, wisdom, honesty, and courage, are a great way to sort of flip this, this giant, at times very discouraging issue of health in the Anthropocene, and twist it to, instead of always leading with our heads, lead with our heart as well. And keep these things in mind and be courageous. And I was trying to think of a brilliant quote to finish off with, and Trevor, I was going to include Margaret Mead and the one you posted in the chat about, never doubt that a small group of citizens can change the world. Indeed, it's the only thing that ever has. But when Sandra said this, I just thought, that's it. That's the quote that really wraps up everything from the last 2 days. We need to do this today so we have a tomorrow. And so no change is too small. And